Assalamu alaikum dear students. Welcome to Dr. Roomi lectures. Today we are going to start the physiology of another endocrine gland, adrenal gland. Let's begin with the physiological anatomy of adrenal gland. There are two adrenal glands in our body, each present at the upper pole of kidney, embedded in a capsule which is made by connective tissue. In the term adrenal, the word ad means next to, and renal means kidney. So it means this gland, adrenal gland, is present next to or close to kidney. The weight of each adrenal gland is just 4 grams, and in each adrenal gland, the outer part is called as cortex and the inner part is called as medulla. So there are two glands in adrenal gland. The outer one, which is cortex, is a separate gland, and the inner one, medulla, is another gland. The outer one surrounding the medulla. The outer zone of adrenal gland, which is cortex, is 80%, and this creates steroid hormones which are lipid soluble. Inner zone is medulla. This is just 20% of the total size of adrenal gland, and this creates catecholamines, mainly epinephrine 80% and 20% norepinephrine, and these hormones are water soluble. It is very interesting to note that this very small gland, just 4 grams in weight, has a diverse type of hormones which it produces. Adrenal gland produces more hormones than any other gland of our body. The outer adrenal cortex, it produces steroids which are lipid soluble hormones. Medulla produces catecholamines which are water soluble hormones. And these two categories of hormones, they are totally different in terms of their mechanism of action, their secretion, their transport in blood, functions, and also their regulation. The catecholamines produced from medulla are derivatives of amino acid tyrosine, and the steroid hormones which are released from cortex of the adrenal gland are derived from cholesterol. The catecholamines hormones produced from adrenal medulla are released in response to stimulation by the sympathetic system, and these catecholamines, they perform all the functions which are performed by the sympathetic system. We will study adrenal medulla and its functions later on. The main emphasis of today's session is the hormones which are produced from the adrenal cortex. The hormones which are produced from adrenal cortex, they are called as adrenocorticosteroid hormones or the corticosteroids hormones, because these are steroid hormones which are produced from the adrenal cortex. So corticosteroids or adrenocorticosteroids is the term which is used for hormones which are produced from the adrenal cortex. The different adrenocorticosteroid hormones are all derived from cholesterol. However, their structure is slightly changed, hence they perform different kinds of functions. Now let's talk about the layers or zones of the adrenal cortex. There are three zones of adrenal cortex. The outermost is called as zona glomerulosa. Middle one, which is the widest, is also called as zona fasciculata, and the innermost is also called as zona reticularis. The outermost zone, zona glomerulosa, is just 15% of the total adrenal cortex, and this is present just beneath the capsule of adrenal gland. The cells of zona glomerulosa are the only cells in our body which produce hormone aldosterone. And aldosterone is a major mineralocorticoid hormone. It's important to note that the adrenocorticosteroid hormones, depending upon their function, are categorized into three groups. The mineralocorticoids, because their main function is to regulate the minerals in our extracellular fluid, mainly sodium and potassium. That's why they're called as mineralocorticoids. And the major mineralocorticoid which is produced from the zona glomerulosa is aldosterone. The other two categories of adrenocorticosteroids are glucocorticoids and androgens, which we'll talk about shortly. Zona glomerulosa contains an enzyme which is called as aldosterone synthase enzyme. It is important to note that different steroidogenic tissues or steroid producing tissues in our body, they contain a different set of enzymes. This is why they produce a specific set or type of steroid hormones. So the steroid which is produced from zona glomerulosa, it is aldosterone, because the enzyme which is aldosterone synthase is present only here. And the aldosterone secretion from zona glomerulosa is controlled by two important factors which are independent of hormones coming from pituitary gland, and these factors are angiotensin 2 and potassium ion. When these two factors or any one of them increase, they increase the release of aldosterone hormone from the outermost layer of the adrenal cortex. It's important to note that even if the hormones which are being produced from the pituitary gland, if they are decreased, especially the ACTH, adrenocorticotropic hormone, then the aldosterone production from adrenal cortex will not be affected. This is one of the most important point which can be asked about these hormones in your examination. The middle zone of adrenal cortex is also called as zona fasciculata. This is the widest zone. It constitutes about 75% of the size of adrenal cortex, and this releases glucocorticoids, mainly cortisol, which is also called as hydrocortisone. Another glucocorticoid produced from the zona fasciculata is corticosterone, and it also releases small amounts of androgens and also estrogen. The innermost zone of adrenal cortex is zona reticularis. This zone produces adrenal androgens and then estrogens and also small amounts of cortisol hormone. Androgen hormones are male type of hormones. Major androgens produced by testes in males are testosterone. However, these androgens, which are dehydroepiandrosterone and androstenedione, are present both in males and females, and they are produced both from the middle layer, that is zona fasciculata, and the innermost layer, which is zona reticularis of the adrenal cortex. ACTH, or adrenocorticotropic hormone from anterior pituitary, controls the secretions of hormones both from zona fasciculata and zona reticularis. Another hormone, cortical androgen stimulating hormone, may also be involved in the secretions of androgens from the middle and the inner layer of adrenal cortex. However, the detailed mechanism for the secretion of these androgens is not completely understood. So we can say that aldosterone, which is the major mineralocorticoid, and cortisol, which is the major glucocorticoid, are regulated by independent mechanisms. Angiotensin 2 and potassium, which are not coming from pituitary gland, they regulate the secretion of aldosterone, and adrenocorticotropic hormone coming from the anterior pituitary gland is important for regulating the secretion of cortisol and also androgens from adrenal cortex. Let's suppose a person is having a disease in which there is increase in production of ACTH hormone from anterior pituitary. What do you think? Which zones or which layers of the adrenal cortex will show hypertrophy? The answer is the middle layer and the innermost layer of adrenal cortex will be hypertrophied, and there will be little or no effect on the outermost layer of the adrenal cortex. And in those conditions in which there is chronically increased level of angiotensin 2 in our body, there will be hypertrophy of the outermost layer of adrenal cortex, having no effect on the middle and inner layer of the adrenal cortex. It's important to note that more than 30 steroids have been isolated from adrenal cortex. However, just two of them are very important. One is aldosterone, which is mineralocorticoid, and the other one is cortisol, which is the major glucocorticoid hormone. We call cortisol a glucocorticoid hormone because this increases our blood glucose level by increasing gluconeogenesis. So because it mainly affects the carbohydrate metabolism and increases the blood glucose level during times of stress, that's why we call it glucocorticoid hormone. But this hormone also affects the metabolism of proteins and lipids. And the androgens are called as androgen because they have effects like male sex hormones. Although they are weaker androgens, but they are called androgens because their effects are like male sex hormones. In the reproductive physiology, you must have studied that male and female sex hormones coming from testicles and ovary are regulated by luteinizing hormone. Is there any role of luteinizing hormone in the regulation of these androgens which are released from the adrenal cortex? What is your answer? Yes or no? The answer is no. Luteinizing hormone coming from anterior pituitary has no effect in controlling the excretion of these androgens. So you can memorize it how? LH for lower hormones. Lower hormones means coming from lower glands, which are testes in males and ovaries in females. So those hormones from ovaries, estrogen and progesterone, and testosterone from testes, they are regulated by LH hormone. But androgens coming from the adrenal cortex, they are not regulated by LH hormone. So the main functions of these three zones of the adrenal cortex are to regulate salt, to regulate glucose level, and to control some sexual functions. So in this way we can write here salt, sweet, sex. So deeper we go into the adrenal cortex, sweeter it becomes, which means aldosterone because it has functions to control minerals, so salt, cortisol because it has functions to control your blood glucose level, so sweet, and androgens because they're related to The reproductive function, so sex. Salt, sweet, sex. Sometimes students may be confused with these names of the three zones of adrenal cortex. There's no need to worry. Glomerulosa, because there is a glomerulus like arrangement of cells in the zona glomerulosa, but it has nothing to do with the glomeruli which are found in kidney. So that's why we call it glomerulosa, because rounded structures or arrangement of cells are present here. Fasciculata, because bundles of cells are arranged here, and reticularis, because cells are arranged to make reticulum or network. So that's why we call it reticularis. A simple acronym GFR can be used to memorize the arrangement of these three layers from out to inside. GFR actually is used for glomerular filtration rate, but here G is for glomerulosa, F for fasciculata, and R for reticularis. So just to summarize, this adrenal gland, which is just 4 gram in weight, has diverse functions to perform. The outer part, adrenal cortex, it produces steroid hormones. The inner part, medulla, produces catecholamines, which are derivative of tyrosine. Steroid hormones, also called as adrenocorticosteroid hormones, are derivative of cholesterol. Slight change in the structure of cholesterol produces different types of hormones and different functions. The major mineralocorticoid which is released from the zona glomerulosa is aldosterone. It regulates sodium and potassium level in our extracellular fluid. And the major glucocorticoid which regulates your blood glucose level during times of stress is cortisol. It is produced mainly from middle zone but also a little bit from the inner zone. And the major androgens which are produced from the middle and the inner zones of the adrenal cortex are DHEA or dehydroepiandrosterone and androstenedione. Angiotensin 2 and potassium ions regulate the secretion of aldosterone from the outermost zone, and adrenocorticotropic hormone regulates the secretion of hormones from the middle and the inner layers of the adrenal cortex. So it's important to note that even if there is some decrease or increase in the secretion of ACTH from the anterior pituitary, there is little or no effect on the secretion of aldosterone from the adrenal cortex. Aldosterone and cortisol are important survival of the person. So that's why when there is deficiency of these hormones in the body, death may occur. Let's study what will be the consequences of losing a specific layer or zone of adrenal gland. First, let's talk about outermost layer. If you remove this zona glomerulosa, hypothetically, then there will be deficiency of this hormone aldosterone, which is the major mineralocorticoid in our body. Because this mineralocorticoid hormone, it controls our sodium and potassium level, so there will be deficiency of sodium, because mineralocorticoid normally increases the reabsorption of sodium from distal convoluted tubule and from the collecting duct of nephron. So when there will be decreased reabsorption of sodium, there will be less water reabsorption as well, and this will decrease the volume of your extracellular fluid. When your extracellular fluid volume will decrease, blood pressure will also decrease, because blood pressure is directly proportional to your fluid volume in the body. And in severe cases, there will be too much drop in blood pressure and it can lead to circulatory shock or hypovolemic shock. This can lead to death of the person. So we can say that mineralocorticoid hormone or aldosterone is important for survival of the person. Without this hormone, the person cannot survive. Normally, aldosterone hormone increases secretion of potassium ions and hydrogen ions into urine. And in case of deficiency of this hormone aldosterone, because this zona glomerulosa has been removed, will decrease the secretion of potassium and hydrogen ions, so their level will increase in our blood. Increase in potassium means hyperkalemia, and increase in hydrogen ions means metabolic acidosis will occur. Now let's talk about what will happen if you remove these two zones, zona fasciculata and zona reticularis. In case of removing these two zones of the adrenal cortex, there will be deficiency of the cortisol and androgens. When there is deficiency of glucocorticoids in our blood, there will be decrease in the permissive action of catecholamines. It means that epinephrine and norepinephrines, they cannot exert their effect, because the action of epinephrine and norepinephrine on blood vessels through alpha receptors is increased when cortisol hormone is present in our blood. And this deficiency of cortisol will decrease the level of alpha receptors on our blood vessels. Hence, epinephrine, norepinephrine, even if they are present in our blood, they cannot perform their function or their function will be decreased. This is because cortisol has a permissive role, so that when this is present, it allows the other hormones to perform their function. So when there will be less effect on the alpha receptors of blood vessels, they cannot constrict, hence there will be dilation of these vessels, resistance will decrease and the blood pressure will decrease. And this will contribute or add to the decrease in blood pressure or circulatory shock, which is caused by decrease in aldosterone hormone. As cortisol also has metabolic effects on carbohydrate, lipids, and proteins, its normal function is to mobilize energy sources to provide glucose and fatty acids during times of stress. So, when there will be deficiency of cortisol, there will be less release of glucose from glycogen and there will be less breakdown of fats, hence, less fatty acids will be produced. So, when these people who are having deficiency of glucocorticoids in their body, if there will be some stressful situation, for example, if they start doing exercise or if they are fasting, this may be fatal because there may be severe hypoglycemia which can cause their death, because in such stressful conditions the glucose level cannot be increased and hypoglycemia can cause the death. Now what will happen if we remove the adrenomedulla? Adrenomedulla is actually a part of your sympathetic nervous system. This produces two hormones, epinephrine and norepinephrine. 80% is epinephrine and 20% is norepinephrine. Because norepinephrine is also released from the sympathetic postganglionic nerve fibers. Hence, even if we remove this adrenomedulla, the person will be able to survive. However, this will decrease the capacity of this individual to mobilize glycogen to provide glucose and also to cause lipolysis to provide fatty acids. In stressful conditions, for example, during exercise and during exposure to cold. So if I ask you this question, which hormones from adrenal gland are important for survival? Aldosterone is important for survival, both during resting conditions and also for stressful conditions. When this hormone will be absent in our body, there will be decrease in extracellular fluid volume, blood pressure will decrease and circulatory shock may occur. What about cortisol? Deficiency of this hormone when a person is resting can not cause death of the person, but severe deficiency of this hormone, especially during stressful conditions, can cause death of a person. So cortisol hormone is especially very important for our response to stress, for us to adapt during stressful situations. In Addison disease, when there is deficiency of aldosterone and cortisol hormone, the person can die, especially during stressful situations, and that is called as Addisonian crisis. What about the deficiency of androgens? Can it cause death of the person? The answer is no, because they are not essential for survival of a person. What about the catecholamine hormones which are produced from the adrenomedulla? Are they essential for survival? Once again, the answer is no, because norepinephrine is also released from the postganglionic sympathetic nerve fibers. This is why even if the adrenomedulla is not there, the sympathetic nerves, they can provide all the functions of the sympathetic system. However, only the capacity of the person to mobilize glycogen and also to mobilize fats will be decreased. In our next session, we will study the transport and metabolism of adrenocortical hormones. Thank you for watching this video. See you next time with another video.